Well, I just wanted to highlight the 6 pillars of lifestyle medicine. There are 6 main pillars, really. One is to adhere as much as possible or to adopt a whole foods, plant-based way of eating. And that may be a stretch for some people, but any move away from the standard American diet, and the acronym of that is SAD, right? Any move away from that is a wonderful step forward. Another pillar is optimizing and individualizing physical activity plans. And both of those help health, longevity, and mood. Both the whole food plant-based way of eating and the physical activity, increasing that. And then there is also improving restful sleep. Very important. Every good day starts with a good night's sleep. Making and maintaining good social connections is also critically important. Stopping smoking and avoiding other harmful substances. And then finally, managing stress with healthy coping strategies. So those are the 6 pillars of lifestyle medicine.
Please note that the opinions and ideas shared on this podcast are those of the speakers, not the opinions of the Ogden Surgical Medical Society or its board. While medical topics will be discussed, it is not to be taken as strict medical advice, and individual clinical judgment is warranted in applying information to patient care. It is the responsibility of the listener to judge for themselves the applicability of the information discussed with regards to their medical practice.
Okay, everyone, welcome. This is the podcast of the Ogden Surgical Medical Society. I'm here. My name is Dr. Scott Moore. I'm a pathologist and a lifestyle medicine physician working at Weber State University teaching clinical chemistry. And today I have with me a co-interviewer, Dr. Rifleman. Dr. Rifleman, would you like to introduce yourself?
I'm a family practice physician. I work for over 2 decades at a federally qualified health center in Ogden, Utah. And a proud member of the Surgical Medical Society here in Ogden.
Well, thank you. We also have today such an amazing opportunity to be able to hear from Dr. Ira Schrijver.
So I'm an adjunct at Stanford, live in Oregon on the West Coast, and I was a medical director of Clackamas Volunteers in Medicine, and now I'm in the process of setting up a lifestyle medicine program for them.
Thank you so much. We are so excited to hear from you today. You're so interested, and you don't just stop at all this volunteer work and all this education and stuff, but you actually recently wrote a book.
So I primarily wrote the book to highlight the connections between the mind, the body, and the world by which they are influenced. And I am inviting the readers to question what they think we know about healthy living. There's so much contradictory information out there, and it's very difficult to separate what is factually correct and reliable from that which is not deserving of our attention. And our perceptions of what is valid really influence our behavior and our health. So I am summarizing our current knowledge and also looking at where our knowledge comes from, all the things that sidetrack us in determining what is valid and what isn't. And in the first half of the book, I really delve into why science is important, why it's a great foundation for what we know. And I do that with lots of stories and examples. And in the second part of the book, I look at what we know and what we don't know in topics such as stress and happiness and nature versus nurture and alternative therapies. And by doing that, I really hope to engage the readers in questioning what we know and realizing that it's, you don't need to go with smoke and mirrors. And it's really a question of, am I going to be taken on a roller coaster ride, or am I going to be in the driver's seat as much as possible?
Wow. Decision making and knowing that you have control over your health. That is this book. I think I need to get me a copy of that.
So as I looked at your career pathway, I saw clinical pathology and genetics and molecular pathology, and now lifestyle medicine. Would you mind talking a little bit about that pathway? And I guess for me, and maybe the listeners, what is lifestyle medicine?
Absolutely. So let me give you a little bit of background. I was born in the Netherlands, and that's where I went to medical school. And then I did a postdoctoral fellowship at Stanford. And after that, eventually, I became board certified in clinical molecular genetics and in clinical pathology. And then I had a very rewarding career on the pathology faculty at Stanford, where I had many different hats. I directed the molecular pathology laboratory, but also had a research lab and directed our clinical pathology residency program and the molecular fellowship. So, never a dull moment.
Yeah, for sure.
And eventually I became full professor, decided to move to Oregon, actually step away from employment altogether, even though I'm still very happily affiliated with Stanford as an adjunct clinical professor. And that opened up a whole new avenue of new adventures. We had more time, of course, to travel and explore the Pacific Northwest, but it also allowed me to pursue some interests, to nourish my love of learning in different ways. As physicians, we have so many ways to make a difference and so many opportunities, really, that the measure of success can easily become, are you happy? Are you feeling fulfilled? And that led me also to the writing of my book. So in Oregon, I became involved with this volunteer clinic, Clackamas Volunteers in Medicine, which is a free clinic for the underinsured and uninsured in our large county. And I had time finally to write my book on health, well-being, and fulfillment. It's On the Path to Health, Well-being, and Fulfillment. And during the writing of that book, I actually discovered the relatively new medical specialty of lifestyle medicine. So it appealed to me very much, even though it seems like quite a contrast that a pathologist, focused on disease, would write a book on health and well-being. But I've always been quite interested in health and well-being, but also in that tipping point where you go from well-being to dis-ease of any kind, right? And I was so impressed with lifestyle medicine and with the urgent need for it in medicine today that I decided to become certified. Now, just for your audience, let me summarize real quick what lifestyle medicine actually is. So it's the evidence-based medical specialty that uses lifestyle therapeutic intervention to use as a primary approach to prevent and treat and also often reverse the chronic diseases that plague us in the world today. And it does so by addressing the root causes. And that's really exciting. I mean, there is a solid body of science behind it, but it really looks at the whole person and it helps people adopt and sustain the behaviors that can foster health and well-being over a lifetime. And that way, we can actually achieve health restoration and a return to the vitality that we all want. And, that actually has a ripple effect. It has an effect on the patient, on the person who is adhering to lifestyle medicine principles, but also their family, their community. And I might say to healthcare itself, because as physicians, we really need lifestyle medicine as well. And so I think in a way it makes the world a better place.
I actually had a question. As you have so much, free time with all your serving and all your writing and all your working, and what, pray tell, sort of movies does a pathologist like to watch, a clinical genetic pathologist?
Well, I like to watch a variety of different movies, but in my copious spare time, one movie that stood out for me recently was actually a movie from Iceland, of all things, and it's called Innsæi. That's an Icelandic term. Let me spell that for you. It's INNSAEI. And it means the sea within, so our inner landscape, or seeing within, or seeing from the inside out, so having insight. And it's a documentary about the power of intuition. And these filmmakers have made such a creative movie. I just loved watching it. They are going on a global journey to interview scientists and artists and spiritual leaders to help us reconnect with our intuition in this world that is full of stress and disconnect. And, it's about the art of connecting, about the way of being less distracted in this world. And they even look at how mindfulness impacts school children. So I found it profoundly inspiring, and it's for free on a platform called Canopy with a K. So everybody could watch it.
I guess I'm gonna have to watch that. That's two things I got to take care of now. I gotta watch it. Man, thank you.
Dr. Schrijver, could you help me understand a little bit more about lifestyle medicine and the importance of scientific research or scientific evidence in lifestyle medicine? Is it more in the alternative medicine realm, or is it more in the Western medicine scientific realm?
Oh, that is such an important question. Thank you for asking. It is absolutely in the house of medicine. It is science-based, and it is something that actually takes us back to the fundamentals of medicine. It's how we should practice medicine. We are such a medication nation right now. 3 out of 4 doctor's visits actually end up with a prescription. And lifestyle medicine helps us cut out the middleman by addressing the root causes and by not simply putting on a Band-Aid, so to speak. And it takes a little more effort in a sense, because it's not the case that a lifestyle medicine physician preaches what should be done. It's really rather inviting the patient to a dance and to addressing the interests that the patient has in terms of improving their own health and well-being. And by doing that, you can actually translate willpower into skill power. So we all have good intentions. The first of the year rolls around, and we all have the intention to do X, Y, or Z, to eat better, to move more, to stop smoking, who knows what it is. But after a little while, without the fuel of positive emotions, our willpower is not enough. So what I really like is the concept of positive health, where we take the 6 pillars of lifestyle medicine and help the patients connect with positive emotions. Because by doing that, we can actually foster healthy habits and positive emotions in a circle, in a good kind of circle, so that we can sustain the changes that we want to make. And that's a very powerful combination.
The best kind of positive feedback loop that there is.
Exactly.
I've sort of noticed some, maybe some lifestyle modifications are more important than others. Some may be of lesser importance, but I think they all work together and they all amplify one another. However, as we talk about the 6 pillars of lifestyle medicine, is there kind of an order? Are some of them more important than others? Are they more effective?
Yeah, I totally agree with you in the sense that they fit together like pieces of a puzzle, right? And they are all important, because you cannot exercise yourself out of a bad diet, for example. But if I had to choose one, then I would say the way we eat is a key factor, because it's the largest risk factor today that is driving chronic disease rates and deaths, premature deaths in the world. And that is because of heart disease, because of diabetes, increases in blood pressure, and cancer. And this factor is even driving more than 80% of our healthcare spending today as well. So it's important to combine the pillars. But if I had to just pick one, then I think the way we eat is profoundly important. And any small change in that can make a big difference.
My mom had this whole saying growing up, and I was always an athletic kid, so I didn't really think anything of it. But it was some guy working out and had a 6-pack of abs on the picture, and it says, a 6-pack of abs is not made in the gym, it's made in the kitchen.
Ah, very true.
Oh, okay.
Great phrase.
Are there any other, I guess, if we're talking about health and longevity, are there important factors like genes or lifestyle? So nature versus nurture, like which ones kind of trump there? If we want to discuss open that Pandora's box a little bit.
Absolutely. Let's dive into that. So, genes determine less than a quarter of the variation in human lifespan, less than a quarter. And until the age of 70 or 80, it's actually lifestyle that is much more important in how well we are doing. So, there was a large study that I describe in my book that looked at 56,000 people. They looked at the risk for heart disease in these people. So some people were in a low category, some in an intermediate category, and some in a high risk category. And it turned out that by modifying the lifestyle, each category could slash their risk by the same relative amount. Now, you could say in the low risk category, that doesn't make much of a difference because you're already low risk. But in the high risk category, that is huge. So that is really important and impressive. So I just like to emphasize as a geneticist that genes are not your destiny. We can make a difference in our health, well-being, whether we develop chronic diseases or not, in any phase of life. And it's really more about gene activation and gene expression rather than the genes we were born with. Of course, people have genetic disorders, they have predispositions, and we can never just wipe those away. But it turns out that it's more important which genes are turned off and on during our lifetime, and to what degree they are turned on or off. That's gene expression. Those things specifically are very much influenced by the lifestyle we have.
I have a great saying that I tell patients a lot of the time is, your genes may hold the gun, but lifestyle pulls the trigger.
Dr. Schrijver, Dr. Moore had asked you a question about giving a little bit of weight, or which is the most important of the pillars, perhaps in longevity. But as we think about preventing disease and even reversing disease, would you still say that diet or nutrition would be the number one pillar? Or can you even say one pillar is more important than the other in reversing disease?
I think that all of the pillars are really important. People can generally not tackle all of them at once. Sometimes somebody has a major scare or an event where profound changes are fostered right away, and that's great. But for most people, health really is a journey, and they have to take things one by one. I think that it depends on where the patient is and what they can do and what they're willing to tackle. But starting with a way of eating that is more oriented toward whole foods rather than processed foods, and plant-based rather than animal-based, serves everybody well, universally. And so that's a great place to start.
Wonderful. Is there a difference in the health between the people of Netherlands and the people of the United States? Have you looked at that, or is it looked at?
I have looked at that. Yes, I try to write my book in a way that it's not only oriented on the United States. Of course, we live here and the book is in English, so definitely plays a major role. But I think we also need to look at the rest of the world. And what we see there is actually that the diseases, the chronic diseases that we see in the world today are very prevalent in the United States. So, for example, 60% of Americans have a chronic disease and 40% of Americans have more than one. Many people here have heart disease. About 1 in 3 have prediabetes, and the vast majority don't even know it and don't know that they're on track to develop actual diabetes. And then more than 70% of Americans today are either overweight or obese, with more than 40% are actually obese. Now, these are alarming statistics, and these numbers have been rising over decades. But the rest of the world is not that far behind. We see this common trend, and the reason really is that we are moving more to shelf-stable products, more and more to convenience foods, to larger portions, to processed foods. And that is at the heart of the matter. So yes, the people in the Netherlands as yet are generally healthier, but these, common diseases of the Western world are definitely need to be addressed there as well.
It's a fascinating topic, and I'm excited to read your book. It's quite a large book. How many pages is it?
300 something.
Wonderful.
I
And
should
that's a
know this.
and that's a summary of lifestyle medicine. That's amazing, and I'm looking forward to it. How does this play into our ability to thrive, not only to avoid disease, but to be able to enjoy life, find happiness, and thrive, and maybe be able to be resilient when difficult times come?
Absolutely. And that is a important distinction that you're making there. Resilience is how you manage stress, and it's not the same thing as thriving. So I subscribe to the possibility of increased health and happiness for everyone, and that is in part the cards that were dealt, our circumstances. It's also our lifestyle choices, and it is the way in which we look at the world, right? It's in part a matter of the mind, a mind that can play tricks on us. But when we realize that we are worthy of better health and happiness, that our measure of success should be how we feel in any phase of life and whether we are happy, then we can really move from resilience to thriving. And that realization surpasses this idea of having to hold on by leaps and bounds. And that helps health and happiness and people genuinely thrive. So yeah, I think that it's really important to ask this question: how can I live my life in a way that I feel as good as possible for as long as possible?
I love that. It's kind of setting a goal and saying, I want to do this. I want to achieve a great life. And then the next question is, but how?
Yes, exactly.
So I guess I'll go back to another question saying, we talked about happiness, we talked about stress management, we talked about possibly changing your diet and all these 6 pillars, right? So I want to discuss maybe how specifically happiness might, even just making the intentional decision to be happy in difficult times or even through good times. How does that contribute to health and longevity?
Yes, so health and happiness are intuitively connected with longevity. And now we also have the science to back that up. So that's exciting, actually. It's an exciting time to delve into these kinds of things and to look at them. With happiness and longevity, the differentiating factor might well be behavior. So this is really fascinating because what we see is that happier people tend to have better health habits. So they tend to be more active, they tend to be less likely to be smokers, for example. But we also see that people who develop healthier habits become happier. So is it the chicken or the egg? That's kind of the
Yeah.
question there. And the important thing there is to keep in mind that all of these things are connected and supported by science on a large scale, right? So you cannot say, I'm a very happy person and therefore I'm going to live to be 100, or I'm a very unhappy, grumpy person and I eat French fries every day and therefore I'm going to die at 35. That's also not true. There are no guarantees in life, and we need to look at the large body of evidence. And there it is very clear what the factors for good health actually are. But there are no guarantees in life. So we cannot really say that it's black and white. It's all a game of likelihoods.
But is there a gene for happiness, or is it something we learn?
Well, only about a third of our happiness is determined by genetics. Very
Okay.
good news, because that means that for 2/3 of our happiness, we can take responsibility and we can make changes in our life that might make us happier.
We haven't touched on this, and I'm not sure if you want to or not, but adverse childhood events, how does that play into our health as we become adults and even our happiness and our longevity, all those elements?
Adverse childhood events do play a major role. They are important. This is one of those things that cannot just be erased. Same with things like racism, for example, or poverty, or having fewer chances in life for other reasons. All of those things play a role. Our life circumstances are important. With adverse childhood events, it's not that people cannot overcome them, but it is an extra barrier, and it plays out throughout life. There are also studies on weathering, for example, in people of color, microaggressions that are cumulative over a lifetime and basically cause premature aging and premature illness because it all factors in.
You used a term there that caught me off guard, weathering.
Weathering, exactly. And it's a term that describes this, this premature aging in the body and premature illness or a higher risk of illness because of those constant exposures. So it goes back to the adverse childhood events, but it can also continue, throughout life when these experiences repeat. So if a child is born in poverty, for example, there is less of an opportunity of having a happy childhood. Now, money doesn't buy happiness, but having enough money creates an advantageous ecology for the child. So what I mean by an advantageous ecology is that the child may be living in a safer neighborhood, might be going to better schools, may have more access to healthcare, and maybe may have more access to activities with friends. So that all factors in as well.
That's such a great thing to understand is for me, and this is kind of the first time I've heard it, that genes are only responsible for about a third of our happiness. I guess I lucked out because my wife always says I'm a perpetually happy individual. I have perpetual positivity. I won the lottery on that gene.
That's great.
Yes. What makes us the most happy? And what supports our health the very most?
So there's been this study, the Grant study, maybe you've heard of it, where they looked at a group of men for decades, more than 7 decades. And I think the men who are surviving are now in their 90s, but there is a large body of research done on them and on their families. And they did questionnaires and they visited the families and they took blood samples and so forth. And they found that at the heart of healthy and happy lives are good relationships. So that's more important than wealth, than fame, than superior achievement. And the lessons were that social connection is profoundly important. And it doesn't matter how many friends you have on Facebook. It basically means that if you're not lonely, because loneliness is detrimental to health, to happiness, and to longevity, then you're probably okay. It's important that you have good relationships. And even that, if that's only a few, that actually really makes a big difference. And it makes a big difference in quality of life as well. And what I find exciting as a scientist is that we can actually measure this, right? So social connection effects are measurable. You activate the parasympathetic nervous system, which reduces anxiety and is important for relaxation. We can measure serotonin, which is the feel-good hormone, oxytocin, the love hormone. Dopamine gets activated for pleasure and reward. And so all of that works together. And I find that very exciting that we know this from a qualitative study, but we also have laboratory information to back it up.
Throughout this entire interview, there's been something ringing in my head. I just have to ask. It has to do with lifestyle medicine again and the 6 pillars. Where does spirituality fit into that? And I might be able to answer that after your last response with the social connections, but how does lifestyle medicine view spirituality?
Yes, if we are able to combine the pillars of lifestyle medicine with positive emotions, then we increase our physical, mental, social, and spiritual health as well. If people feel connected through their spiritual activities, if it is meaningful to them, then we really go back to the pillars of positive psychology, actually, which are positive emotions, engagement, relationships, meaning, and personal sense of accomplishment. So spirituality connects to several aspects of that. I think that is an important aspect of our lives as well.
I thought I would hear it was a separate pillar, but you're right. It has this connected, it's connected to many of the pillars.
There was something you said about social engagement, and it just got me to thinking, there are different types of social engagement. I mean, obviously we have like the internet social engagement, which is not really super social engagement. It's like talking to people that you don't know. But are there types of social engagement here in our families and in our communities that are better than other types of social engagement? Like, what should we, if we are going to be choosing what types of social engagement, because everyone who's listening to this podcast probably has so much time that they can just do every social interaction they possibly want. So if we're going to be selective to what promotes our health and happiness the most, what would that be?
It would be what is the most meaningful and enjoyable to you. I'm an introvert. I would not be comfortable going to a party with 100 people where there's the expectation to mingle all the time and then feel happy. I can do that, but it is not something that nourishes me, right? For me, it would be a walk in the woods. For other people, it would be going to that party and talking to absolutely everyone. So we all need to find what works for us and what really nourishes us the most. And that will then automatically contribute to your own health and well-being.
Great. On a personal level, but vicariously for all of our listeners. And I do want to thank you. I'm so excited for Dr. Moore's conference next year, particularly because of what you're going to bring, and I expect a lot of your colleagues will bring regarding lifestyle medicine. But what would you recommend to me and to our listeners as the top things we can do today to really improve our health?
I think that for us in healthcare, it's so important to evaluate our own health, right? So if we're on this path of health, well-being, and fulfillment, we do need to reflect on our past and look where we came from and look how far we've come, probably also. Look at the present, where we find ourselves today, and then create a compelling vision for the future. And I would encourage everybody to take a little while for introspection. It doesn't have to be that long, but to take a moment and ask yourself, how can I genuinely thrive? Because in order to do well, in order to do good also, you have to be well. And so for physicians, we have this tendency of just powering on without a break, right? There is this code of conduct, an unspoken code of conduct, I would say, to power on no matter what. And we hold ourselves to this high standard and our colleagues as well. So we need to take a step back and foster that kindness within us and compassion for others in the workplace, and most of all, also for ourselves. And realize that baby steps are okay. It's not all or nothing. Every good thing that you can do for yourself actually makes a difference. It pays into the bank of health and well-being. So I would encourage everybody to do that and to think about what nourishes you, what supports you. And very important in that is also to not just move away from a situation you don't like, perhaps, but to, as I said, create that compelling future so that you can move towards something with enthusiasm and with energy. Those would be my top tips.
Great. I did not expect that answer, but what I heard was take some time to look from where we've come, take some time to actually see where we are. And the one that really struck a chord with me is we need to have a vision of where we want to be and how we're going to get there. And maybe, like you said, in our profession, sometimes we don't take the time to do that.
I hope you do. And we're worth it. It's important to be able to bring everything to every single patient encounter.
I appreciate that.
Dr. Schrijver, thank you so much. This has been an incredible podcast episode. I even learned stuff. I learn stuff every time I talk with you. I'm really looking forward to your talk at our conference in May. And I'm really looking forward to hearing what else we have, because I'm sure I'm going to learn a lot of things as well.
As I prepared for this, I actually looked into the requirements to become certified in lifestyle medicine. It's very interesting, and it's a pathway I think a lot of physicians could take.
I just went through the process like 2-3 years ago, And Iris just went through the process, and so we're fresh. We did the process fairly within 2 or 3 years.
What is the process to become certified in lifestyle medicine? As a family practice physician, I've been practicing 20 years. Is that something I should consider?
Yes, you could. I would encourage everybody who's interested in lifestyle medicine to check out the American College of Lifestyle Medicine. They have an excellent website that talks about the certification process. And because lifestyle medicine is often practiced in a team, there is a certification at different levels as well. There is the physician level, but there's also a certification for other professional levels, for example, for dietitians and nutritionists, or for physical therapists. So everybody can take boards in lifestyle medicine at their own level. And that makes it very exciting because we do need to work in a team to really deliver that kind of healthcare. But the American College of Lifestyle Medicine has many different resources about certification, but also patient-facing resources to apply in your practice today. So I would just encourage people to check it out.
Great. Thank you very much.
And I want to thank you for having me. I'm so excited to talk to you and to be coming to the conference virtually, but still to be able to give a talk there. And it's an honor and a privilege to talk to both of you.
Great. Well, thank you so much for your time in the middle of a Friday. It's wonderful.
Thank you.